So the next speaker that we have is Mina Haji, and I'm passing the mic over to you, Mina.
Thank you. Hello, everyone. My name is Mina, and I'm a PhD student at the University of Cape Town. I'm just checking if you can see my screen.
Yes, it's visible.
Perfect. Cool. So I do want to apologize for my voice. I'm a little bit sick. And thank you for bearing with my voice. Actually, today I will be presenting the research protocol for my PhD. So there will be no findings yet. Hopefully in future I can present the finding as well. The title of my PhD is Economic Cost and Health Outcomes of Gender Affirming Care in Adult Transgender and Gender Diverse People in South Africa. Sorry. In this presentation, I will cover an introduction, a short one, background, study rationale, aims and objectives, methods, and data analysis. I believe that we all know the terms that I'm going to quickly review here, but I need to go through them very quick to establish the study rationale. For my PhD. So I'm going to use the gender unicorn diagram. This diagram provides a breakdown of differences between gender identity, expression, and sex assigned at birth. As we all know, gender identity is the individual's internal sense of being male, female, neither of those, both, or another gender. Gender expression or presentation is the physical manifestation of the individual's gender identity. The sex assigned at birth is the sex assigned to a child at birth, and the classification of a newborn as male, female, intersex, which is most often based on the child's external anatomy. And transgender, the term, is an umbrella term that refers to people whose sex assigned at birth and their own internal sense of gender identity are not the same. That note, I'm going to go through the other terms as well. Gender dysphoria is the mismatch between the inner gender identity and the sex assigned at birth. Gender dysphoria may provoke distress and mental discomfort, which might result in, the mismatch between the inner gender identity and sex assigned at birth might provoke some distress and mental discomfort that results in gender dysphoria. As we all know, transgender and gender diverse people might experience gender dysphoria at some point in their life. And this population is one of the most marginalized social group globally and also in South Africa, and they are at an increased risk of mental ill health related to transphobia, discrimination, and gender-based violence. Transphobia and discrimination are unfortunately major barriers to healthcare access, and they can result in increased risk of other health concerns which are not related to gender or sexuality. Many transgender people, they experience social exclusion and discrimination because of the way they're experiencing their gender identity. As we all know, gender affirmation is a key social determinant of translated health. It has different components, and as I said before, it's good to note that not every transgender individual experiences the symptoms of gender dysphoria, but for the group that they're experiencing these symptoms, being affirmed in their gender identity is crucial to, in alleviating the conditions and to improve their health-related quality of life. Despite the medical recognition of gender dysphoria as a legitimate healthcare need, most of the insurance companies all around the world, including South Africa, they still they consider the gender affirming care as experimental and elective, and as a result, they are not happy to cover it. I'm going to quickly go through the information that already has been mentioned. So the WHO reflected that the trans-related and gender diverse identities, they are not conditions of mental ill health, and classifying them as such can cause stigma. The WHO International Classification of Disease, the new edition, the 11th edition, has replaced the diagnostic categories like transsexualism with gender incongruence of adolescent and adulthood, and gender identity disorder of children with gender incongruence of childhood. Generally, the gender incongruence has been moved out of the mental and behavioral disorder chapter into the new condition related to sexual health chapter. WHO has highlighted that inclusion of gender incongruence in the ICD should ensure TGD populations access to gender affirming care, as well as adequate health insurance coverage for such services in different settings. So the background also, I'm pretty sure that everybody knows about the current situation in South Africa. Regarding gender affirming care, both the public and private health system in South Africa are providing different services, but there are drawbacks to both of them. In the public system, depending on where an individual is based in the country and their ability to access those services, to access the transgender related services, they might be able to access psychosocial support, gender affirming hormone therapy, gender affirming surgery. Something that is really bold is that the wait list, especially for surgery, is long and growing in public sector due to different results, such as limited resources and theater availability. And also, we know that gender affirming care is also available from private clinics, which it means that although the gender affirming care is technically available in South Africa, the access is unequal and it's limited for all but the wealthiest. When we are going through the access dimensions, aside from the availability, affordability is another access barriers. And as I said before, most of the insurance companies, they continue to understand these services as elective, and these services are not also included in the South African prescribed minimum benefit package. I'm going to quickly introduce or review the prescribed minimum benefit package in South Africa. There are a set of defined benefits to ensure that all medical scheme members, they have access to a certain minimum health services, regardless of the option that they're using. And in South Africa, the Council for Medical Scheme is required to make submissions to the National Department of Health for the review of the PMB package based on the inputs from committees and stakeholders. Based on the Medical Scheme Act, the National Department of Health is required to monitor the impact, effectiveness, appropriateness of the PMB packages provision to ensure that the national health insurance and the PMBs are aligned. A review is to be conducted at least every 2 years by the National Department of Health. I'm not quite sure if it's happening based on the regulation though. One thing that's important for my study is that the cost effectiveness of health technologies or interventions, they can lead to inclusion of those interventions in the revised prescribed minimum benefit package. I'm going to use that introduction and introduce the study rationale. In South Africa, there is a limited research on the transgender and gender diverse populations, health-related quality of life. Although the provision of gender affirming care is considered legal, ethical, and medically sound, and the services are technically available, but the access is unequal. The healthcare insurers, they exclude gender affirming care on the basis that it's not medically necessary. and they are not also included in the prescribed minimum benefit package. But based on both the Council for Medical Scheme and the National Health Insurance White Paper, the cost effectiveness of an intervention can lead to inclusion of such services in the benefit package. There is a considerable gap in the literature on the prevalence of gender dysphoria among South African TGD population. The cost effectiveness and budget impact analysis and budget impact of providing the gender affirming services in South Africa. The aim of my study is to explore the economic cost and health outcomes of gender affirming in adult gender affirming care in adult transgender and gender diverse people in South Africa. The objectives are to assess the health related quality of life and well-being of adult transgender and gender diverse people in South Africa, to assess the cost of gender affirming healthcare, including the psychosocial support, hormone therapy, and gender affirming surgery, and to assess the economic burden of gender dysphoria and patient cost of seeking care among the population in South Africa. And at the end, to assess the cost effectiveness and budget impact of the providing those services in South Africa. And we hope that with that result, we can use those results to inform the policy on provider coverage for such services in South Africa. The proposed study will be a mixed method study starting with a comprehensive cross-sectional survey across South Africa among transgender and gender diverse individuals. Using the result of this survey, I will determine the health-related quality of life among the population, the economic burden of gender dysphoria, and the patient costs associated with gender-affirming care. I'm just making a note here. I acknowledge using the patient instead of client, but in this case, I will have to do so because of the other consideration for terminology in economic modeling. The second element of the study will be a retrospective cost analysis of gender affirming healthcare services from the provider perspective, which are going to be supplemented by cost effectiveness and budget impact analysis at the end. We can break down the data collection measures in cross-sectional survey and in two sections, cross-sectional survey and provider cost data collection. The cross-sectional survey will be an online survey which will be implemented across South Africa. The recruitment process will start from approaching healthcare facilities and NGOs. The participants will be enrolled in the study if they provide consent, of course. If they are 18 years or older, they're based in South Africa, and they do identify themselves as TGD. The different variables that will be measured using that cross-sectional survey has been listed under the question design. And the other data collection measure is the provider cost data collection, which we can also divide into two categories: primary data collection and secondary sources. In the primary data collection, the ingredients approach will be used to cost the gender affirming surgeries from the provider perspective. Considering the hormone therapy, the hormone prices will be obtained from the open access databases, and the secondary resources will be used to estimate the unit cost per visit in private sector using the Discovery Medical Aid tariffs. And in public sector, we will be using the data from Health System Trust District Barometer. I'm not quite sure if I have time to go through the data analysis or if anybody is interested, but I think that's, I'm going to stop here. And if you have any question, I can answer that. If you want me to go through the data analysis, I can do that as well.
Thank you very much, Mina, for that presentation. I'm going to ask maybe if we have probably, well, let's create 1 minute for question, just one question and one short question.
Sure.
Has that?
Sure.
And I see Robin's posted some data on the chat if you'd like to have a look. Anyone
Yeah.
with a question?
Sorry, I'm just.
Okay, so I'm not going to ask anything for sake of saving time as well. Jonathan, you
Okay.
unmuted yourself. Did you want to ask something?
I just wanted to ask about the PMV, trying to change that, because I know it's been something, yeah, I think that has been brought up in other spaces, if there is any knowledge in the group around if that has been worked on.
Anyone, would
So.
you like to respond, Mina, if you have?
Yeah, but my actually my knowledge on that is not that broad, but I believe that based on the regulations, they are supposed to review that package every 2 years. But when I was like searching, I've noticed that they haven't done it for the past at least 4 years, I'm assuming. But they have to do that, and that package will be used both for private insurance and maybe in future if the NHI is coming to effect, we don't know. But I was hoping that doing this study and hopefully if the providing the care is cost effective, then it really doesn't matter which system is in power. We can advocate for even reviewing the package using the results.
Thank you very much.